Hello, this is Will Johnston from the Michigan Institute of Urology. Today I'd like to talk to you about PSA testing for prostate cancer. Please note that this discussion does not replace your meeting with your urologist or physician to discuss your individual case. First of all, what is the prostate? Prostate is a walnut-sized gland that is used to liquefy fluid carrying sperm. It's a gland involved in reproduction. The prostate is located just beneath the bladder and in front of the rectum. In men, as they age, the prostate grows, but some men may develop prostate cancer. Prostate cancer is actually the most common cancer that a man may develop, and is the second most common cause of death among men, secondary only to lung cancer. What is the incidence of prostate cancer per year? This graph shows for different age groups over the years from 2000 to 2008 how often prostate cancer is detected. For example, in men ages 50 to 64, out of 100 men, 3 of them will be diagnosed with prostate cancer this year. For men in their 70s or 80s, almost 1 out of 10 men will be diagnosed with prostate cancer this year statistically. Prostate cancer does not usually present with symptoms, and this makes it hard to detect at early stages. Some men may develop symptoms when it's very advanced. So how do we detect prostate cancer? Well, 2/3 of cancers today are detected by an elevated PSA. 1/3 of them are detected on exam. What is the PSA? PSA stands for prostate-specific antigen. It's a substance that's made by the prostate, both normal and cancerous cells. But cancer cells tend to make more PSA than normal cells, and thus when the PSA increases rapidly or its absolute value is high, it may suggest that there could be cancer. Unfortunately, other things can cause a jump in the PSA. Infection, a recent Foley catheter, enlarging prostate, these things can also increase the PSA. The physician or the urologist can look at trends and look at values and help determine whether there's enough suspicion to move to the next step in the evaluation for prostate cancer. I like to think of the PSA as the fire alarm. Fire alarm goes off, one has to see if there's a fire. The PSA goes up or increases rapidly, one needs to take the next step to find out if there's a cancer. The alarm may go off and there may be no fire, but it deserves investigation. What is a normal value? For men less than 50, a PSA should be less than 2.5, or for men 50 to 70, less than 4, or the velocity or how fast it changes should be less than 0.5 to 0.75 per year. Who and when should you get PSA testing? Well, men with family history of prostate cancer or African Americans have a higher incidence of prostate cancer and should begin at age 40. For most men, a baseline PSA around 45 and a digital rectal exam yearly is recommended. Is there an age limit? Well, we know prostate cancer is slow growing, so if a man has less than a 10 to 15 year life expectancy, PSA testing is not recommended. There are different medicines that can decrease the PSA, such as sal palmetto, or Proscar, or Avodart. And when a man is on these medicines, we typically have to interpret the PSA as higher than what the true reading is. Therefore, these medicines can mask or hide a potential prostate cancer. Let's look at an example. A 60-year-old man, his PSA is slowly going up, and he was started on Avodart. The following year, his PSA only went up 0.1. Well, because of the medicine that he was on, I would expect his PSA to have actually dropped in half, not increased by 0.1. Therefore, this man needs further evaluation for why his PSA essentially went up. Does PSA testing work? An article was just recently published in the New England Journal of Medicine. It was a European study of 182,000 men. And the conclusion was from the study that if a man's going to live 11 years, PSA testing resulted in a decreased death from prostate cancer. What do you do if you have an abnormal PSA? The first thing is to recheck the tests and then consult with the urologist or physician. The urologist will recommend a biopsy of the prostate because there's not an imaging test that will detect cancer. It's done by a tissue sampling that is completed in the office under a local. It takes about 7 to 8 minutes to do, and it's well tolerated. If patients have abnormal PSAs, there's an evaluation process that your physician will go through. And this chart just shows some of the complexities that exist in evaluating PSAs. The diagnosis is made under the microscope, and the pathologist assigns a score to how aggressive the cells appear. Scores of 1 and 2 are usually not given out. A score of 3 is a less aggressive on the scale, and a score of 5 is more aggressive. A Gleason score, which is a combination of the most common focus of cancer and the second most common focus of cancer, is provided. Let's look at an example of Gleason score. If the pathologist looks under the microscope and sees a focus, and it's the most common focus of cancer, he gives it a score, let's say of 3. If he looks under the microscope and sees another focus and it's a little more aggressive appearing, but it's a smaller volume, he'll give that a score of 4. The combined score is a 7, so this man would have a Gleason score of 7. The Gleason score, along with PSA and the volume of disease, give the most prognosis for how the disease will behave. Let's look at a chart of Gleason score where it's broken down into low risk, intermediate risk, and higher risk. Patients with a Gleason score 5 or 6, I like to think of these cancers as the poodle. They're a little more predictable, generally aren't going to bite, and highly curable. When we have Gleason 8, 9s, and 10s, they're a little harder to cure. They can bite you like a pit bull can, but certainly today, if caught early, we can even cure these. Treatment options depend again on your risk factors, anything from robotic surgery, radiation, or even sometimes active surveillance, watching the cancer. All these treatment options involve looking at Gleason score, PSA, other health conditions of the patient, and are reserved for a long discussion with your urologist to help find the treatment that's best for you. For every patient, there's a treatment that's right for them. The take-home message, PSA helps with early detection. Early detection allows more treatment options and better chance at cancer removal. For patients with more than a 10-year life expectancy, PSA testing decreases your risk of dying of prostate cancer. In my opinion, currently PSA is the best test we have for early detection. There's currently other PSA tests under investigation, and this should improve our ability to detect prostate cancer. If caught early, prostate cancer is highly curable, and there are advances in robotic surgery and radiation currently that have led to higher cure rates with less side effects from treating prostate cancer. Thank you very much.